So I have been really nervous about making this video because it is a topic that is huge. I mean, I'm talking about a 100-page bill, and there's so many different aspects of that bill to discuss. But today I was looking at some posts that were made online by people who seemed very intelligent, and I was noticing that there's some pretty big holes when they're talking about Bernie's Medicare for All plan. There's a lot of like misconceptions. I think that different people have different goals in talking about it. And a lot of times, if you're just listening to the person who's talking about it, you don't necessarily know what their specific goals are. And a lot of times, it's really not covered in its entirety. The main thing that people talk about is, well, yeah, universal health coverage. Awesome, right? Every other major country in the world does it. But those countries aren't America. They don't work the way America works. And some of their healthcare systems aren't great. And health-related outcomes, infant mortality, and even just in general quality of care, taking all those factors into account, we're not even in the top 3. And we make you pay tons and tons of money for it. So it's not about having better quality by making more payments into the healthcare structure. It's really that these companies, they're making so much money, they have no reason to want to do things any differently. It's working for them. And for the people who love their insurance, dude, I love my insurance. I looked really long and hard because having a good health insurance is very important to me as a person. And I mean, I've told tons of people how much I love my health insurance. But why do I love it? I love it because I can go to the doctor and only pay $5 out of pocket. I have great low copays. And I really looked for a plan that had no deductibles. A lot of people that don't go to the doctor very often, they really get, screwed over by deductibles because they never even meet their deductible. They never are able to move into the part of the plan that really saves you more money. So that's a big problem with deductibles, is that you have to pay this much. Most deductibles range anywhere from $1,000 to even $10,000. And these deductibles we should really look at as the cost of your health care. I know insurance is very, very complicated. I actually considered working as an insurance agent. So I actually went to a training. They trained me all about the different terms and everything. It was so complicated. And I consider myself a relatively intelligent human being. It is hard to understand these health insurance plans. So half the time, you're like, either A, I'm not going to get sick, so I'll just get a plan. And those plans can have all sorts of nasty surprises for you. Or you're like, man, I know these insurance plans, they often don't cover what I need. I'm just going to pay for a really expensive plan. But it's hard to understand what the different aspects of it are. Beyond deductibles, there are copayments. I'm sure you understand what copayments are. When you go to the doctor, you give them a certain amount of money. Your insurance gives them another amount of money. However, I have great copayments, like I said. And I go to the doctor, and often I'm billed for parts of their service that insurance just doesn't cover. So even though I pay my copay, that's supposed to be all I pay for that, any sort of like service or treatment while I'm there can add money on. An insurance plan can cover your costs or cover your prescriptions up to a point, and they call it a donut hole. I learned this when I was at the pharmacy the other day because I was trying to get a prescription that I've had a lot of trouble getting. I got a pre-authorization, and I went and I picked it up the first time. Kid you not. Then I go back to pick it up a second time. Pre-authorization isn't on file. So my doctor has to resubmit the pre-authorization. My insurance says they can't even see that anybody has opened my account ever for any pre-authorization. So then that process starts all over again. In the meantime, I'm like, I'm already taking this, and suddenly out of nowhere, oh, never mind, we don't have it. It's lucky that it was something that, I was able to live without. So there's lots of things like that take a great insurance plan that you love and really make it kind of terrible. And because I've done insurance training, I have an advantage. So when I'm looking at what plan I want to get, I know what to look for. I found a plan that didn't have a deductible, and this plan that I love, it costs over $1,000 every single month for me. I'm paying $12,000 per year minimum for my insurance, right? Now, when people start talking about, oh my gosh, we're going to raise taxes on the middle class, we don't want to cost the middle class anymore. Guess what? As a middle class person, maybe even lower middle class, but as someone who is definitely not a part of the upper echelon of earners, if I am paying $12,000 a year just for my plan, and suddenly I pay nothing for my plan, do I really care if my taxes go up $500, $1,000? I mean, I don't, because at the end of the day, I save more money. And that's something that I think the media doesn't really emphasize properly, because insurance is confusing. If someone told me to have Medicare for All, to have health insurance for everyone, that my taxes would go up, I'd be like, no, I don't want them to. But if someone told me, hey, your taxes are going to go up a little bit, but the $12,000 goes away, then I'm going to be on board. Now, I'm not saying that every single insurance plan costs $1,000 a month. Usually, a household is going to pay at least $500 a month for it. But let's go down even more. Say that plan costs $50 a month, but then we also have to pay, co-pays, and then we end up having to pay for our prescriptions. So we'll just say $100 a month. Very low estimate. Take away that $100 a month cost, then you're not going to care if you pay $200, $300 more in taxes at the end of the year, because you've saved over $1,000. So that's really an important thing for people to remember. And now the next thing that you hear is, well, that's basically forcing people to have insurance. Well, let me tell you. Hospital bills are the number one cause of bankruptcy in the United States. So if you can afford it, if you're smart, then you get health insurance, because things do happen. So say you're a very, very poor person and you just can't afford health insurance. I've been there. I've been a struggling college student. The people who really can't afford health insurance, this is great for them, because their taxes won't go up. This is only going to apply to the upper, middle class and top earners. So do you know who really doesn't want this? If you are a multi-billionaire, the percentage that you're paying of your money for health insurance is minuscule. Not because the cost is any less for you to have health insurance, but simply because at a certain point, thousands, hundreds of thousands of dollars becomes a small amount of your income, much more income than anyone could earn or could spend. Anyone could spend in their lifetime. Then yeah, this is gonna definitely raise your taxes. But if you're in the middle class, yeah, you'll see your taxes go up a little bit, but all healthcare costs gone. So the reason that I've been reiterating, hey, I love my insurance right now, I love my insurance, I've been trying to point out what it is that I like about it. Why do I say I love my insurance? My insurance is not my doctor. My insurance is not my healthcare options. My insurance has nothing to do with the outcome of my healthcare, and it has nothing to do with the quality of my healthcare. My insurance is simply about financing. How much money does it save me? You tell me, hey, the insurance that you love so much that's letting you go to the doctor for $5, guess what? You can keep that, but you can go to the doctor for free. Who in their right mind would be like, no. Let me keep paying a monthly bit to the insurance company to charge me more for going to the doctor? So that's where people get really confused. It's like, you can't have your insurance. You like your insurance, your insurance is a part of your, is a part of your employment benefits. Well, yeah, insurance, that's good, is great. But wouldn't I prefer not paying for insurance? Yeah, if it was completely unnecessary, getting rid of private insurance. It has nothing to do with taking away your choices. You have just as many choices. In fact, you have more, because then you're not stuck with in-plan doctors and out-of-plan doctors and all that malarkey. Then you can actually decide, I can go to any doctor in the world. So why do we want to get rid of these insurance companies? Well, the only part of the bill that actually kind of gets rid of them is it says it's not legal for a private insurance company to charge an individual for services that they're already getting for free. And this is important because insurance is confusing, right? So if this insurance company comes along and they're like, hey, it's only $5 a month and you get all this, and you don't know any better, you don't know, hey, I'm already covered, I got this Medicare for All thing, I don't need to pay you even $5 a month to get all that, I already got it. Then insurance companies can prey upon people who don't have as much information. So the only part of the bill that actually gets rid of the private insurance companies is simply just saying that they cannot duplicate coverage. If you're already covered, if you can already go to the doctor for free, they can't charge you for it. Right now, Medicare itself, it doesn't pay for as much as Medicare for All will. Medicare for All is a name. It doesn't mean that everyone gets Medicare. No. It covers a lot more than our current Medicare. Isn't that great? So it's Medicare in name only. It's just expanding what we already have. It's using the system that we already have set up. If your parents are at an age, or if you are at an age where you're getting Medicare, as I'm sure you know, you can still go to those same doctors. And it's just a different person that's paying. It's the government that is paying. It is fascinating how whenever they're like, hey, we got to have a couple $1 million to build a bomb just in case. It's not during wartime, but we should build it. No one asks, how are you going to pay for it? But we have something that really benefits the individuals of the country, and suddenly it's like, oh my God, how do we pay for that? How do we pay for that? You have to understand that insurance companies are making billions of dollars right now. So they will say anything and everything to make you think this is a bad idea. They're not a value-added component. All they do is they take the money that we're spending for doctors and then they pull more out because they're making money. These companies wouldn't exist if they weren't getting more money than what they're paying out. Our medical care is suffering for it, and people are going bankrupt over it. We're the only wealthy country, first world country, that's not doing it for their citizens. So yeah, I love my insurance, but let me tell you, I don't want an insurance company to tell me, oh, we'll give you great coverage for something that I already have. I don't want them to be able to trick me. So don't think that this elimination of insurance coverage will affect you in anything other than a positive manner.